November is Stomach Cancer Awareness Month. Gastric cancer is the 5th most common cancer and the 4th leading cause of cancer death worldwide in 2020. Joining us to talk about it is surgical oncologist Dr. Subhasis Misra. Great to see you, doctor. Thanks for being here.
Thank you for having me.
We want to bring awareness about stomach cancer, focus on that. I feel like whenever you hear anyone who gets a cancer diagnosis, the first thing the other person says is, oh, what were you feeling? What were your symptoms? Because it's our own fear of, could that be happening to us? What are the signs of stomach cancer?
Right. Great question, Roxanne. It's the early stages. There are not very specific signs. So what happens is we get a lot of non-specific signs and people often tend to ignore. But if any of those signs, persist for more than 2 weeks or more, then I would definitely encourage people to go and check it out. So one of the common signs is, loss of appetite, persistent heartburn. You eat a little bit and you feel extra full, or you're losing weight and you don't want to. Sometimes you can have upper pain in the upper abdomen or belly area, and you just get a sense of bloating. Occasionally people may have nausea, vomiting, but those are more advanced stages. But in the early stage of stomach cancer, those are non-specific signs.
So I like that you're saying this. If this happens for more than 2 weeks or so, go see a doctor, find out what's happening, and what tests would be done at that point to determine whether or not there was cancer.
Right. So there are various tests that your primary care physician or gastroenterologist may do. Sometimes they'll start with basic blood test and then see, is there low hemoglobin or, blood count is low. Oftentimes we have to do an endoscopy, upper endoscopy, to see if there's any growth. And then based on that, they'll do some biopsies. They'll check for any presence of any bacteria or any other definite cancer cells. And
if cancer is identified, what are the treatments for even some of the various stages?
So depending on the stage, early stage versus advanced stage, and most of the time when people have symptoms, it is pretty advanced. But across the board, you will have a combination of surgery, chemotherapy, plus minus radiation therapy, and there are other areas of how we can work to improve on those treatments.
And if someone is able to go through these treatments, or when they are, what kind of care afterward, what kind of prognosis afterward, moving forward?
So one of the key things in the eastern part of the world, gastric cancer is very common, and so we want to catch those early. So if you can catch them early, you have a longer survival rate. But for here, most of the time, 1 in 3 people will barely live up to 5 years. So it's a very aggressive cancer. It does change your lifestyle in terms of how much of your stomach is removed and what we need to do. But there are other resources that we help through to the patient so that they can survive in this journey.
And what about diet while you're going through that and after treatment? How does that change? I'm sure it does.
Right. So diet actually has a big role also in prevention. I'm glad you brought it up because a lot of the people eat processed meats, and those have been linked. Anything that is more like pickled, processed meat, those have a tendency towards causing cancer. So I would, avoid those, of course, and then, keep up a high protein diet, and those will help in your recovery.
It's a challenge eating well in today's world, but it's so important, like you said, for preventative. Dr. Misra, I really appreciate your time. Love learning from you. Love what you do. Thank you very much.
Thank you.